Now to a very important global health challenge. Obesity is a global problem and we're not making progress. The World Health Organization says all countries are significantly off track and will miss 2025 targets to hold obesity rates steady. Now, according to the World Obesity Federation, rates have nearly tripled since 1975 and have increased almost 5 times in children and adolescents. Well, let's talk about that now. And we're joined on the line from Cape Town by paediatrician Dr. Iqbal Karbani. Dr. Karbani, thank you so much for joining us. Now, you work extensively with children and obesity. Have things started to improve, or are things simply getting worse?
Hi, morning, Sally. Well, unfortunately, the situation is becoming basically much worse. It's becoming a pandemic. Obesity is becoming a real problem in children, and that unfortunately means that unhealthy children will become unhealthy adults.
Absolutely. What are the health risks for obesity in children?
Well, there's numerous health risks. What we find is that, as you know, most people know about the adult risks of obesity, cardiovascular disease, hypertension, diabetes, for example, type 2 diabetes. We normally see that something called metabolic syndrome. We see it in older adults as they get put on more and more weight as they get older. Unfortunately, we're seeing the similar phenomenon now in children. Children as young as 8, 9, and 10 are becoming so obese that they're developing type 2, which is adult onset diabetes. And that's just the tip of the iceberg. In South Africa, almost 1 in 8 children is actually obese. And that's a frightening statistic if you think about the health implications and the global health cost and the cost to the South African economy of just being overweight.
We've seen in Portugal they're making some progress on childhood obesity in recent years. They have started taxing sugary drinks. We are the first country in Africa to be taxing sugary drinks. Is that helping? Do you think it could help?
I think it's a start of a number of steps that need to be taken, and it's a very important step. But I think people first need to understand that obesity is a manifestation of a lifestyle. And often when parents come to me with an obese child, I tell them that the treatment of this child is the treatment of the family. It's not just treating the child. So you can't expect a child to eat healthy if the parents are eating unhealthy. So instead of looking at it as a problem, I tell them to rather look at it as an opportunity for everybody to start embracing a healthier lifestyle. So in other words, parents need to stop buying sugary drinks, stop buying the sweets and all of that. Because what most people don't understand is, and I've seen this over and over again, they'll come with an obese child to see me and they'll say, well, they've enrolled the child into the gym once or twice a week. That's going to make absolutely no difference, unfortunately. 90% of weight gain is purely diet related. It's got nothing to do with the level of physical activity in children, because the amount of physical activity that's required to significantly reduce your weight is actually quite a lot of physical activity. So you've got to be running long distances, you've got to be doing a lot of activity if you want to simply control your weight through exercise. It's diet, diet, diet all the way.
Absolutely, and as you say quite rightly, Dr. Karbani, it's very much a family problem and has to be tackled from a family perspective. Thank you so much for your insights. That's paediatrician Dr. Iqbal Karbani. It's 9